Hi everyone, I think we're ready to begin.
I'm going to try and project, but I've got a famously quiet voice. But hello, welcome. Thanks everyone for coming to this event. It is Healing Seeds, a panel discussion to explore the connection between nature and health. This is one of a series of talks and panel events that are happening this week as part of the Weston Arts and Health Festival 2022, which continues until Sunday. And we've got a programme of free events, so make sure you have a look at everything that's going on. Our panel today will be chaired by Dr. Alice Walker, and she'll be joined by Steve Winter-Gray, Karen Blake, and Sam Francis. So I'll hand over to them.
So thanks for coming everyone. My name's Alice Walker and I'm a clinical psychologist. I work for UHBW, so I work at the BRI in a staff support service. So my day-to-day job is supporting staff with their well-being. But I've also got a special interest in how nature supports all of our well-being and how kind of really thinking about how many of us in modern society have become quite disconnected from our surroundings and our environments and what that does for us kind of individually and societally, and how we might start rebuilding our connection with nature that benefits us and it benefits our ecosystems as well. So that's kind of the lens that I'm bringing today. But as a psychologist, I'm particularly interested in how nature helps us with our mental health and well-being. Do you want to introduce yourself?
Yeah, certainly. My name's Steve Winter-Gray. I am the Community Development Coordinator for Community Connect, which is a council-funded service delivered by Curo. I cover the North Somerset West area, so that's Weston, Wirral, Clevedon and the surrounding villages. And I have a counterpart that also covers the North Somerset East area, which is everything else that I don't do.
Okay. I'm Karen Blake and I wear a lot of hats. One of the hats I wear, and I'm looking at Natalie, is I've just started a job over at Grove Park as their outreach worker. So that's connecting people to the activities and the volunteering we do there to kind of get people involved in the local park and connected to nature. But mainly I'm here to represent the absolute powerhouse and wonderful friend of mine that's Anna Southwell, who should be talking here today instead of me, but is actually making all the amazing food for the events that are happening as part of this over the weekend. But I'll be speaking about the Weston Super... I've completely forgotten the name. This is why Anna should be here, not me. The Supermare Sea Swimmers Group, which is something that Anna set up in July 2019 and has been really beneficial for hundreds of people's mental health locally. So yeah, I'll be talking more about that.
Hi, I'm Sam Francis. I also wear several hats. I've worked with Karen on different projects, but I'm here, so one of my projects called Grow Feral, which I've been working on for the last few years. Originally, I was approached by Weston to develop a community engagement project, and part of my own sort of creative practice was sort of moving into working with more green things. So I was doing creative projects and bringing sort of growing into that. So Grow Feral sort of developed out of this sort of first iteration where I worked with Osprey, who there's some Osprey people here in the room. They have a community allotment, so I've done projects with them, and a few different projects in the town working with different community groups to do creative growing projects.
Thanks.
And on Sunday?
Sorry, there was a comment I didn't know.
I didn't know.
So we're just going to be having a bit of a conversation, really, to bring in all of what everybody here is doing. But we're going to have plenty of time for questions. So if things are coming up for you as we go along, please hold them in your mind, and I'll make sure we've got time that you can ask any one of us questions. But yeah, I guess I want to kind of just kick off. I'm so conscious that all your roles do amazing things to connect people, both with other people, their natural environments, their communities. And I would love to hear your senses of kind of your experiences of what that does for people. What have you noticed in the people that you work with about how the projects that you're working on are supporting people's well-being? Feel free to just chip in if you want. I'm not going to ask that to any particular one of you because I imagine you all might have quite a lot to say about that. Who feels able to answer that first?
I'm happy to go first because I'm looking at Johnny actually over there, who needs to be bigged up for all the stuff that's happened in Grove Park, which kind of came from you and your commitment to it. I mean, certainly what getting people involved in the park and being involved in nature and actually caring about that park is that it's changed the way that people are responding in there. It's made it a friendlier place for people to hang out. People are improving their well-being through volunteering. Brilliant cafes have sprung up by the name of Sprout Cafe. Go and visit it at some point. It's amazing. But yeah, just there's more of a sense of community, and I think it's really important to have opportunities where people can come together in those spaces because it gives you purpose and meaning, and it's really important that we're connecting to nature. I could go on and on, I won't, but just in terms of the climate crisis, we really need to care more about nature, otherwise people won't want to solve it.
Yeah, thanks. That's brought up lots of really great points, and what it made me think about was how you made a comment about how it's change something about that place and how people feel about it, and the power of supporting people to care for their local environments and how that can change the nature of a place in terms of helping it feel safer. People start to notice how it feels to be in a place that's looked after and actually start to care about their local green spaces, and that can have lots of kind of reciprocal benefits for both nature and for people. So that's great, thank you.
I think certainly from my perspective and the customers that I represent with the wellbeing workers that I work with, for the last 2+ years we've spent a lot of time telling people to stay indoors, and I think I can share my thoughts with everybody here that when you spend that much time, you get your Stockholm syndrome and you get the four walls, and all of a sudden when you suddenly open the floodgates and everyone gets very excited about the fact that they've missed what they couldn't have or what they didn't have access to at the time. And certainly what I'm finding from a lot of the people that I represent, because I work with the over 50s in the community as far as opening the door to the services that they haven't had access to, is actually just being outside and actually just being able to get out of the house and prevent them from being socially isolated and lonely, and actually looking at opportunities that are available. And we've got community assets out there, and much of the work that's done from certainly what we all do is around actually utilising the community assets and actually making the best of those, but at the same time not just what we've already got, but how we can enhance those by either volunteering or giving up some of our time if we are have the opportunity to do that, and then that benefits the community as a whole, essentially what's known as asset-based community development, so that we've got something to give back to something that exists there to make it better.
That's great, thank you. And it brought up some really important points about kind of what it's been like for people in the pandemic, and often I think the pandemic's really shone quite a light on the importance of connecting with our local environments and what it's like to be isolated from each other and from green spaces. And it reminded me of a piece of research I read recently, done by the Mental Health Foundation, that really highlighted how important people's local green spaces were and people's connection with nature for managing the stress of the pandemic. And that many people kind of have commented that without even being able to see something green, their life through the pandemic would have been quite a lot more challenging. And it also raises a point which I'm hoping we might come back to about how our access to natural spaces is very unequal. So we don't all have the same access to green spaces, despite it being quite a public health issue. So we might come back to sort of issues about how we support people to access their local green and blue spaces. But thanks for that perspective. What about you, Sam?
What was the initial question?
I think it was around what, from your experiences, what do you notice are kind of how are people benefiting from connecting with each other and kind of connecting with nature through the work that you do?
Well, I think there's definitely something about like creating something, because initially you start with a seed and then that turns into potentially a tree, and it's like you've got everything sort of in between that. And if you're part of making that happen, which we are as humans, we take this seed and then we put it somewhere and we nurture it and we watch it grow and we tend to it. That like really brings like value and meaning into your life. It's like you're actually looking after something, and you're looking after the planet, you're looking after the people that you're with, and you're contributing to sort of creating the space that you're doing this in, whether it's a park, whether it's an allotment, whether it's your garden. You're bringing green into the world, and there's something really hopeful about that. And I think just people getting their hands in the earth, like, and being physical, even if it's sort of small, in small ways. I think definitely, from working on the allotment, doing projects there, it's like seeing how much people benefit from being in that space, really, and have done historically for decades, actually.
I was just thinking as well that it reminds me of something that we've been talking about a lot in some of my studies, is that actually the problems of the world can feel so enormous and so huge that it almost makes you stop and, like, where do you start with solving it? But actually seeds can grow in different ways, because the seed that was planted with the sea swimmers, which came out of just a few of us who used to go swimming in the sea and wonder why no one else was doing it, because we knew how beneficial it was and we knew how amazing it made us feel. But from that, with the supermares being set up, I would say that definitely contributed to a group of people coming together, which has made the mudlarks, the Western mudlarks, come to life, which has salvaged the marine lake. I mean, I know there was a lot more to it than that, but actually it's people power, it's people coming together. So maybe rather than trying to solve all the massive problems, if you start small, you can make bigger things happen.
That's, I'm not quite sure how to follow that, because that's such a lovely summary of some of those big topics, and I think says a lot about how we can support each other to connect to nature, as a lot of it is coming down to what we have on our doorsteps. And I was thinking about talking about planting a seed and watching it grow, and there's a lovely metaphor in that as well, of kind of starting small and watching something grow, but through connection, and that might be through connection to our neighbours and our community, but it might also be connection to the earth, and how powerful it can be to watch something grow, whether that's a literal tree or kind of a metaphorical tree through a project or something.
I'd certainly echo that with even the individuals that potentially aren't able to get out and about as such, but are able to enjoy, for example, a garden or a window box. And certainly the number of requests that we have come through to request, for example, gardeners and people to be able to clear spaces for individuals that are housebound, but they want an outlook, so they want something to be able to look at. Although they can't do it themselves, they have a positive interest in knowing that that will make a positive difference if something's done about it. So it could be something as simple as actually just tidying up some window boxes or some planters. But as volunteers, as individuals that have got neighbours or friends or family, that you've got some time to give up for. That's the sort of difference that the whole green social prescribing element looks at, which is that actually how much of a difference will it make if you just go there and spend an hour clearing somebody's garden and actually putting a plant in a planter that was once empty. And actually that can really change somebody's day, it can really change their outlook, and it can certainly change from where they get up in the morning and open their curtains and look at something that wasn't there yesterday, and they get to then follow that whole journey, that whole process, and right the way through, as you've said, from planting the seed up to the point where they get to enjoy what comes to fruition. So there's huge possibilities, and it doesn't have to be wide open space, it can be a tiny little pot.
That's so lovely to bring an example of kind of nature nearby and what we can do on our doorsteps. And gosh, there were so many things from what you were saying that I really want to ask more about, and it sparked off a lot of things that I've read in the research around kind of how people feel invested in their local space when they've had a say or an involvement in what that space looks like. But also what it does for us psychologically to be able to see something green, even if it's out of a window while we're inside. And there's actually a really interesting study from the 80s that started off quite a lot of our modern understanding of part of the reason nature's so beneficial for our health, was that someone looked at recovery after surgery in hospital patients, and they compared a group of people who could see a view of trees out of the window and a comparable group who were looking at a brick wall, and noticed quite stark differences in the recovery times, use of pain relief, and the kind of post-operative complications. All of those were much more favourable in the people that could see trees, which I just find absolutely fascinating. And as someone who works in healthcare, I think, gosh, why don't we talk about this more? Because it could really influence how we think about the environments that we both live in and kind of are cared for in. I'm easily going to go off on many tangents here, but you mentioned green social prescribing, and I wonder if we might just chat about that, because I suspect you're all involved in some way in whether it's through a formal social prescribing scheme or not, but ways in which we can support people for their health and well-being to connect with green or blue spaces. And people might be familiar with green social prescribing or not, but I suspect it might be a slightly new term for people. And I wonder if between you might be able to say a little bit about what it is.
All eyes on me. Brilliant.
The floor is yours.
Suddenly feel very overqualified. As part of my role as a community development coordinator, I manage some wellbeing workers who deliver essentially a social prescribing contract for North Somerset Council with the Community Connect service. As part of that, we look to encourage individuals within the community to express their interests to us. When we go out and we home visit them, we aim to home visit every single referral that comes into us, and anybody can refer into us. And what we like to find out is what people's interests are. And from that, we get to build essentially a referral criteria that we can do something with. And where we're looking at the fact that we are in this beautiful North Somerset rural area, we have so much green space to benefit from. The majority of our customers talk about being able to get out and about into local green spaces. They talk about their gardens. They talk about being able to get involved in clubs and different activities that relate back to them being able to either get their hands dirty or to be able to actually just benefit from being outside, whether it be like a walk and talk club, or for example you've got the Portishead Gardening Club, which is a piece of green space that was actually given to the community from Portishead Health Centre, which is now developing into a sensory garden, and people can actually get involved and actually volunteer to turn this amazing space into something more. And more locally, certainly closer to our area in Well, I don't know if you've heard of Stanley's Garden, which is a dementia sensory garden that's actually being set up by one of the Skidmore family, who you may all know on Well High Street. So Stanley Skidmore was David Skidmore's grandfather, and his mum is still residing at home, called Muriel, and they have a piece of land that was next to their house that was a piece of wasteland. And David has been able to get investment and funding and volunteers, and has turned this piece of wasteland into a sensory garden for patients and individuals that have been diagnosed with dementia, because we know it has such a positive influence and effect on people being able to be in a space where they can experience different things that they wouldn't have access to if they were, for example, just in a care centre or in a day centre. Now, the whole point of green social prescribing, or social prescribing as a whole, is to do more with what we have in the community. And it's actually balancing what's called a medical model and a social model. And essentially, if you have a complaint that can be dealt with through a tablet, for example, that's your medical model. But if you have a issue around being socially isolated or lonely or not engaging with the community, you can then adopt the social model, which is to understand why do you feel that way. If there's a root cause, for example, if it's like secondary mental health, then that will need to be addressed alongside being socially isolated and lonely, but the two can run concurrently. So we can work with third-party services alongside the individuals that are interested in getting out and about and, for example, getting involved in clubs and societies and different activities in order to reduce them feeling socially isolated and lonely, but to actually give something back to the community by supporting something that's being set up. But on the other hand, if we haven't got something set up, the team that I work with also like a challenge. So if there is something missing in the area, that's my job to then identify people that want to set something up, and I will help them get a group or a venue to set that up, and we will help and support them to get that going and then step back once it's running its course. And that way, what we're using is the assets in the community and individuals that at one point what could have been, for example, either not a drain, because I don't like the term drain, but we're using resources that are already currently pushed within the NHS, and what we're actually doing is we're using people in the community to support individuals and other people in order to essentially get better. And when I say get better, it's about being non-socially isolated, being engaging with the community and then benefiting, and then the longer term means that they actually get to give back as well. That's a potted history, I suppose.
That's very comprehensive, thank you, and really resonates with my experience working in healthcare of so much of what I see day to day is a lot of distress and a lot of suffering that often has arisen because someone's very isolated or sort of part of a marginalised community and struggling to connect with other people who live locally, or kind of suffering from with oppression and real power imbalances in the societies that we live in. That is best solved through community level kind of bringing people together. I don't even want to call it services, but supporting people to reconnect with their community and find meaning and purpose that is quite fundamentally different to the medical model a lot of people are used to operating in. But yeah, I wonder what both of your experiences are of supporting people in that way.
I guess I was just thinking that like all the terms like medical model and social model and you know, they're not really kind of familiar to me. I am connecting with social prescribers through the work at Grove Park, also through some of the work I'm doing at Weston Art Space. But actually for me it's not thinking about, you know, the terminology. I guess I can just think about myself and actually how important it's been for me to make connections through the things I'm doing. I mean, I understand how important it is to have connections and friendships through things, because it's that, and actually the friendships that I've made through the things I'm doing have been the most vital and important aspects of all of this. So yeah, I mean, I can't talk in any depth about, you know, the ins and outs in the way that you did, but actually I was just thinking that it's important that we have these opportunities to connect, because we're definitely going to swap email addresses after this so that so that we can keep, because actually for me at the moment with social prescribing it feels quite early days and it feels like we need to do more work to connect ourselves. So the things that can be offered to people through the social prescribing. Because also, again, thinking about the swimming, I've no real idea how we would do it, because we're not a service, we're not something that people could be referred to, but yet actually as a supportive community, it could be really beneficial to people. So I think I'm not sure what the answers are, but there is something about actually how do we connect people with things which are a bit more informal.
I really want to come back to ask you some questions about sea swimming. Okay. I'm just going to ask Sam, what's your take on kind of social prescribing?
Similar to Karen, really. Fairly new to it. I did get a grant this year from a local green social prescribing grant to do a second iteration of a project that's in the Italian gardens. So there's a load of planters, and I worked with an artist to create a self-watering system. I worked with Karen as well, and we delivered a load of creative green workshops and sort of co-created through loads of workshop sessions with the community what this garden might look like and what it might entail. And then the artist sort of went away and sort of developed it, and then we've got more of a garden space. So that happened partly due to that grant, which is fantastic. I have to say, personally, I've found it, I don't feel like I have a full understanding of how it all works and how people connect. I feel like there might be a missing link. I found it difficult. as I suppose, you know, a producer of a project and a horticulturist and community grower, to actually, how do I find the people to bring to the project? It really felt to me like there's something missing there. You've got people who work like you do, you know, really in that, and then you've got more sort of projects and practitioners, and then there's like, well, how do we find the people? Like, you know, we did quite a bit of work around that, but I struggled with it, I have to admit. So I think that, yeah, it's early days, isn't it, for social prescribing in general, but all that said, I mean, it's been fantastic to sort of think about that, actually, and just to think about how do you access hard to reach groups. It's like, it's really difficult, isn't it? And, you know, like down at the allotment at Osprey, there's a lot of people that have been going there for a long time, and it's, you know, they have that struggle as well, as like how to bring new people into what we're doing, how to give more people the opportunity that I think you were saying at the beginning. You know, not everyone accesses green spaces, and not everyone has that opportunity, and there's like a privilege, I suppose, associated with that in some ways as well. So, you know,
Yeah, it seems like both kind of a challenge and an opportunity for the social prescribing movement to, a difficult thing to do, to make these connections, but also could be a really great way to start working with different communities and support people to access their local areas who might face quite a lot of barriers to doing so if they had to do that on their own.
Yeah, I agree with that. Yeah, certainly with some of the areas that we've got so much wonderful space, and certainly some of the groups that are wanting to get set up, the conversations that we're having, certainly as Community Connect, are that actually people are not having conversations about funding, they're having conversations about venues and space, and that either there are spaces out there, how do we access them, or there aren't venues where, if you're looking at accessibility or people that need to be able to access certain things whilst they're also interacting, we haven't got that at the moment. And also the fact that we've got these surrounding villages with very restricted transport, and we've just lost a couple of bus routes that are so important, that when we're talking about accessing green spaces, and a lot of people seem to just put the emphasis on, oh, we've lost a bus route so no one can go shopping. Actually, believe it or not, some people don't just jump on the bus to go shopping. They do actually go out and interact and engage and visit people and spend time in the park. But in order to access those green spaces, it might be just a little bit too far away to be able to walk. Or if they, for example, have mobility needs, that actually they can take their mobility scooter on the bus and they can get there, they can enjoy that space, they can be part of that, they can feed into that, and then they can go home and actually full benefit from that as well. So I think it's also important to certainly acknowledge that there's a bigger picture around the spaces we've got, accessibility to them, and actually what's going on in the local area to allow people to access those spaces.
Definitely. It's making me think about, so something I'm really interested in is the many ways in which spending time in kind of in the natural environment or with nature, even if that's in urban environments, is how that can support people's well-being. And the research suggests that there's a really large number of different pathways by which nature links with human health and well-being. And I was thinking about sea swimming and what you were saying about a real kind of a really beneficial aspect of the community is bringing people together, and how some natural spaces act as a really lovely platform for social connection and shared interest and sort of experiencing things together, in addition to how we might connect to the natural space and have a relationship with a place or with nature. And I was wondering if you might be able to share some of your experiences from your kind of from yourself of how you've benefited from sea swimming.
I mean, the first thing I was thinking of straight away was actually how awful it was during COVID when the restrictions were in place, because we were a group who were coming together, and actually the group meeting together was the thing. That was the real beneficial thing, and we were then told you have to exercise on your own. Well, you can't sea swim on your own because it's not safe to. It's something that's been really embedded in that group, is, you know, looking after each other as we're swimming. Then it became you could swim with someone, but you had to be, you know, all the 2 meters apart. But actually, yeah, I mean, it was just, it's such a, for me personally, it's been such a brilliant thing for my well-being. I know on a personal level how it's improved my mental health. I know I might be having a really bad day, and if I get in the sea, I suddenly feel 1,000 times better. But I just thinking it's something about things that happen really naturally and organically, because that's what's happened with that group. It hasn't been, there's been no need to kind of force it to become a thing. It's just become a thing of its own accord, and it's really special.
Thank you for sharing that. And there's certainly a lot that I identify with on a personal level. At sea swimming elsewhere in the country where I was in the pandemic kind of really got me through. And something I certainly noticed was how the sea offers up a lot of metaphors for whatever's going on in my mind. And I could often find what I needed in the sea. And I think that's something that I see nature offering for a lot of people, is a way to find meaning in their experiences, and to share that with a sort of constant presence of nature, but also perhaps with other people if they're there with others. And I was wondering about Grow Feral and your experiences of noticing what working with the earth and growing together. I mean, it'd be lovely to hear just a bit more about that project and what you notice for kind of how it impacts on people's well-being.
Yeah, I mean, I suppose that, it's definitely coming from a creative background, so it's sort of looking at it coming from a different route into it, I suppose. So some of the things that we were doing initially was like doing different botanical plant printing, different print methods, and then looking at like creating sort of templates for seed packs, which you can actually buy out here in a little vending machine.
Amazing.
And using wordplay to sort of generate ideas around nature, and think about how all those things sort of connect and are part of growing in the natural world and nature itself. And nature is a sort of material really, and a tool to sort of to create things out of, and growing very much being a part of that. So it's sort of, for me, it's really just sort of bringing those two loves of mine together to make projects happen, and for people to be part of that as well. I like the sort of rhizome metaphor as well. So rhizomes are like different roots that go under the ground, and they all sort of interconnect and communicate with each other. So there's a sort of term like rhizomatic learning. It's like a different, more organic way of like learning and finding out about things. So I like to sort of think about it like that.
I love that. I've never heard that phrase before, and I definitely want to take it and think more about that.
Yeah, please do. It's not mine.
So yeah, gosh, it really strikes me that there's really a lot around connecting. That's had a real sort of connection feel. Both with kind of what we're working with physically and the people around us in that project. And it's making me think a lot about kind of how we do connect with nature. And something I'm really interested in as a psychologist is the psychological impacts of building a relationship with nature, which is often quite countercultural in the kind of the way we live in modern life. We've been very falsely separated from nature, but something that is a sort of obvious fact, but I find mind-blowing, is that for 99% of the time humans have been around, we haven't lived like this. We've lived as hunter-gatherers, and that required an absolutely intricate relationship with nature. And then sort of the Industrial Revolution's here, and that's all gone. Although that's a bit stark, it's not all gone. There's many cultures who are living in harmony with nature and in reciprocity, and it's not right here, which I can find very troubling, but also very encouraging, that there's lots we can gain from rebuilding a connection with nature, but can feel quite challenging in the systems that we operate in, which particularly kind of the history of modern healthcare has often kind of sought to separate the body and the mind, and doesn't fit quite in how we might understand a healthy relationship with nature. I just wonder if you've got any perspectives on that kind of relational aspect of how people relate to non-human beings, and whether you think that's important. Is it part of what you do? Is it something you might support people with?
You go.
No, I was just thinking the first thing that jumped into my head was something we were speaking about just before we started, which was how the concept of people going into nature to get something from it, to find some well-being or some fulfillment, but then, so they're trying to connect with it, but then the absolute disconnect of leaving those places in such a state with all their rubbish and stuff everywhere. And actually, how can we work with that? And I'm not sure what the answers are, but yeah, there is something that we have become quite disconnected with nature. So a lot of what we're trying to do in the park is connect people with nature. But again, it's something about that's an artificial environment that's been created. How can we get people into more natural environments? And actually, what do we do with them when they're there? I'm asking more questions than I'm answering, but
they're important questions though, aren't they? I think they don't have to have easy answers, but they're great questions to ask.
But back to I think what I said in the beginning as well about climate change. It's so urgent that we do something. So really, what are we doing, and how do we connect people to the really important stuff, which is urgent to do? And I think there's something about really getting people in nature, which will help solve it somehow. If I'm being optimistic, which.
Yeah, I'm definitely on the same page around the urgency, and I think you raised such a good point about the difference between being kind of quite passive consumers of nature, which again fits more readily in the culture that we find ourselves in, but actually a more reciprocal relationship might feel a little bit different and a little bit harder to kind of develop. But it reminded me of, I keep doing research drops, which maybe says something about my role as a psychologist in the NHS. But there is some really interesting research about a dose of nature, and we can have a beneficial amount of time in nature. I think it's 2 hours a week or something was shown to be really beneficial. But the really interesting addition to that is that when looking at the amount of time, when that's actually looked at with our connection, which is a different concept to the amount of time we spend in nature, the connection actually comes out as more important. So it's actually the relationship we have with our surroundings that turns out to be a bit more important than spending a lot of time outside. They're linked, because often when people have a closer relationship, they want to spend more time outside. But actually, if we were just to go and stand outside, there might be various benefits for various reasons, but without a relationship with that environment, we're not going to get quite the same benefit. And I think that sort of speaks a bit to what you were talking about. I think you were going to say something as well, Sam, about this.
Yeah, probably can't quite remember, but
I can't even remember the original question.
I'll start where it goes. I was just sort of thinking about that, what you're saying about the sort of disconnect that we have, and I think that we do think of ourselves as not nature. Like nature's like the thing, it's the tree, it's the grass, it's the whatever, it's the animal, it's the other being. But like we're the same, but like we've sort of forgotten that, haven't we? Like over time. And I suppose it's about sort of awareness raising in order to save the planet really now, isn't it? It's like whatever we can do in small ways to try and sort of shine a light on the fact that like we've done quite a bad job of caretaking this planet and we need to change that. And if that's just growing some plants and going to a green space, then hopefully that's the start of some things that can bring positive change in small ways. But it's it's really it's promising to sort of witness, I think, the huge increase of people engaging in this stuff since lockdown as well. And I know for me that's part of my drive for doing a horticulture course and doing more green stuff. All that happened during lockdown because I needed it. Like I needed that. Like I needed to go on that long walk on the beach every day, and I needed to go into the woods. I needed to be in my garden doing all that stuff, and that was like the seed again for me to sort of start doing the work that I've been doing with Grow Feral. And we can witness that with wild swimming as well. It's like how many groups around the country. It's amazing.
It's just exploded, hasn't it?
Yeah. I'm hoping that all the Lidos that closed down all over the country 80 years ago will all open again soon. Let's see.
I think for me, using kind of outdoor swimming as an example is a really lovely demonstration of the many ways by which connecting with nature or being in natural spaces is good for us, because it can bring up the very social aspect of kind of who we go with and those kind of connections and shared experiences. It also brings in the time in nature and how we might build a relationship with the surroundings. But importantly, also there's quite a physiological thing happening if you're swimming in cold water, which you probably very well experienced, and what that can feel like when you get out. But there's quite a growing body of research about some very direct physiological impacts of being in nature on our bodies, and some quite important theories around that. That actually, if we're in more natural spaces, and some of this comes back to our the evolutionary basis for our connection, our fundamental connection to nature, because we've actually evolved to be in a closer relationship, despite what modern life has us believing. That it can do something for our nervous system. So being in natural spaces has a direct impact on the activation of our parasympathetic nervous system. So the part of us that helps us rest and digest and recuperate. That's a very kind of physical link. We also know in forests there's chemicals called phytoncides that come out of trees. So just being in a forest is really good for us. It's really good for our immune system. I read something recently about there's something in microbes in soil that mimics serotonin. There's all these kind of things being uncovered that are really having an effect on our physiology, and so it just strikes me there's almost endless ways that nature is supporting our well-being.
That's
if we
so
choose.
cool.
It's really cool, isn't
really
it?
cool.
Yeah.
It's actually two things that both of you said actually resonate quite well with me, wearing a different hat to what I'm actually here for anyway, but I've got a community partner. So I also am the chair of the LGBT forum in North Somerset, and we have a community partner called Bridging the Gap Together, who actually deal with special educational needs, young people and any adults with undiagnosed conditions as invisible disabilities, and they do something called photo walk. So they've identified through a really good contact in Weston College, so I'm going to drop names everywhere here. So you've got Liz Kelly from Bridging the Gap Together, who heads up Bridging the Gap, and you've got Jamie Dormer Durling, who is their kind of photo guru. And what they actually do is very much what you said about getting people to reconnect with nature, and the same with yourself, as actually being embedded and engulfed in what is actually happening and how that's going to make someone feel. And they actually send teams of young people out with cameras and different types of media to actually take pictures of what they see and tell a story. So although you're not expected to have to talk about what you're taking a picture of, you're telling a story through pictures and reconnecting. And rather than just kind of seeing it with your own eyes and then not able to tell anyone, you're able to share that. And actually to be able to go out, and they've just done a walk up Glastonbury tour that was absolutely phenomenal, and the pictures they've shared are absolutely superb. And these are individuals where months ago their only kind of outlet was they were just stuck in a room, they didn't want to interact with anyone, and now they're literally pushing each other up hills, and they're actually talking about and going back and actually showing each other what they've just done. And that itself is a really, really good example of how much of a difference just getting outside can make to everybody. And we do need to get the message, certainly to the young people, and get them to start connecting and reconnecting with what we've got out there in these spaces, because we're going to hand it over to them, and if it's going to be completely knackered, then they've got nothing to be able to enjoy.
I love that example. I'm so happy that you shared it, because that really speaks to actually a growing body of knowledge about what can help with spending time in nature and how we build a relationship and a connection. And that is such a wonderful activity to go out and take pictures and actively build that connection through sight of what people are seeing in their surroundings. And then another little research drop here, but there's a really important piece of research from Nature Connection that was done looking at two groups, a control group and a kind of research group, who were asked to notice 3 things that they liked, or 3 good things in nature every day for 5 days. The control group were just asked to notice 3 things in their day, like what they had for breakfast or something like that. And at a follow-up a month later or a couple of months later, the 3 good things group there was a significant difference in kind of the well-being impacts of what that intervention had done for them. And that research has since been expanded to hundreds and hundreds of participants through an app. So people logged the 3 good things that they liked on the app. And that included people with mental health difficulties who showed quite remarkable improvements over the time of that intervention, and has led to an understanding of how we connect with our surroundings, and using our senses is a really important way in. So that's one of 5 evidence-based pathways of how we build a connection with nature. So actually we know that just allowing ourselves to notice and acknowledge what we can see or what we can hear, what we can touch in our surroundings is really good for us. It sounds pretty basic, but supporting people to do that, particularly people who might struggle to access for any reason, is a really powerful thing to do.
It's certainly, sorry.
No, you go ahead.
I was going to, it's certainly something that, as far as what I've taken away from that and the other groups that I work with, it's a really, really good, well, I suppose it's a tip, I suppose, that if you are, I mean, I've started doing it myself, that we've all got mobile phones in our pockets. And it is very much about three good things. So actually using the fact we've got technology in our pocket to actually take a picture of something that's had a positive effect on us, and then to be able to reflect on that at the end of the day. And I'd challenge anybody, actually, that when you are going back through some of these pictures, how many of them have you actually taken outdoor space, and how many of you actually taken where it's just indoors? Because I know that we've all stopped on the street somewhere and you've noticed something, phone comes out, because it's something that you've not come across before, whether it be either a spider web or a plant or something that was beautiful in someone's garden. But we can all stop and just take 2 seconds to do that and actually just reflect back on it.
It's a really lovely segue actually into what I was going to say, because I was just about to say that it's really important to acknowledge our challenges, because, you know, I'm talking about all the stuff I do. But also I've got a 13-year-old daughter who is surgically attached to her phone. But it's really important to, because I think it's all too easy to say, the youth are today and all of that, and actually bemoan them for this. But actually we could approach it in a different way and say, how could we utilise the technology that they've got and help as a way of helping them to access nature? And maybe it sounds a bit trivial, but a perfect example of that was the Pokemon game that my 9-year-old daughter was hugely into on her phone, which actually she wanted to go out into the world, and although she was looking at her phone and it's far from perfect, that's my interpretation though, but for her it was like she's had a lovely time outside and she's had fun, and she's been kind of accessing the technology as well. So maybe there's something going forward about what the technology is and how we can use it as a way of getting people to
Got
get back into
geotagging,
nature.
that's
Yeah,
another
yeah,
one as well,
yeah.
actually. I've heard geotagging.
Yeah. And also, you know, again, sometimes it's easy in that disconnect to say, the youth are today, but actually, what are we doing to give them a brilliant environment? Well, as the grown-ups in the room, we've been a bit rubbish, so maybe it's partly taking responsibility for that as well, you know.
Yeah.
They're inheriting what we've done.
And it's mostly the youth that are driving a lot of action that's needed. So.
Exactly.
Yeah. I'm mindful of the time, and it would be really lovely to hear if anyone's got questions. I just want to check in with the three of you. Is there anything you want to kind of say that is carrying on from things we've talked about, or are you happy to start taking some questions?
Yeah, happy.
Yeah? Are there any questions from anybody? And I'm aware there's people up there as well, so I'll look up there.
And whereabouts is it Stanley's Garden?
Stanley's Garden, so it's off of Royal High Street. So if you know the Lamb on Royal High Street, it's the road right next to the Lamb, and you go about halfway up, it's on your left-hand side. And you'll probably find that David is probably there, covered in mud, up to his elbows, just getting stuck in, and he loves people popping along just to have a look at it. It's a beautiful, beautiful place, and you can actually go onto their Facebook page and see the journey that they've actually been on, from a pile of rubble to what they've managed to achieve, and it's all been done through volunteers. It really is, it's phenomenal.
Yeah, we do. Prescribing. So, as the sort of medical on this side, are you able to actually write a prescription for people to say, look, for patients or clients, or to say, I think you should do this. This is what you can do. And then, is there a way that the NHS can then pay for that prescription so that perhaps organisations or groups like yours can actually use that to all fits together?
Great question. I'm unsure if people up there can hear the questions. Do I need to repeat it, or did you heard that? Okay. So it's about green social prescribing. Can it work like a prescription, essentially, in that someone could go to their doctor and the doctor can write a green prescription? Interestingly, that has been done in New Zealand. They have a green prescription scheme. I don't know if it's still going, but that was very much a doctor writing a green prescription to spend time in nature. There's been various headlines about kind of doctors prescribing walks in Scotland and things like that. My understanding is it's not written on a medical prescription, but it is a very valid health intervention. And I suspect you can please do.
The reason I'm smiling a lot is because no less than before we came down, I had a whole conversation with you about the kind of myth busting about what social prescriptions are, or what is social prescribing, and there is this kind of, well, do you just write on a piece of paper, go out for a walk, have a lovely time? The way that the actual social prescription model works is that I am actually part of the social model. My husband, believe it or not, is actually a social prescriber and is funded by the NHS working for the primary care network. So we are the most boring people in the world when we go home at night, I'll be honest, because all we talk about is social prescribing. And the cat can't stand it. She needs a prescription, actually, thinking about it. So how the actual model works is that we either are embedded within surgeries or we're embedded in the community. So you've got the NHS element, and you brought up a really interesting point that's quite topical at the moment about, is the NHS going to look to fund essentially work that's being done to support people that essentially are being supported by the community and are no longer essentially being referred into NHS services. There's a lot of conversations that actually are very much around the primary care network and how much investment's going into that, as far as how much the actual community is being supported by these individuals. Watch this space on that is all I can say, because there's lots and lots of questions being raised. From a social prescribing standpoint, you can be referred either through the primary network if your GP surgery has a social prescribing partner. So you can go to your GP surgery and they may recommend that actually I'm going to refer you to a social prescriber, and that is then picked up by whoever your social prescriber is supported by. Citizens Advice, for example, Peer Health, Curo, Community Connect. There are a whole range of different organisations and companies out there that support the social prescribing model. Once you get referred into that particular model, you will then have either a phone call from one of your link workers or a wellbeing worker to discuss why you've been referred. First of all, you need to know that you've been referred in the first place, otherwise it's a random phone call and you don't know why you're speaking to someone. And normally you'll have like a triage, so we'll have a discussion over why you feel as though social prescribing would be good for you and what you discussed with your doctor within the confines of confidentiality, and then how we can then interact and engage with you to be able to move things forward. One of the things we do absolutely emphasise is that we aim to visit every single person that's referred into us in their homes, because one of the wonderful things about us as human beings is if someone asks you how you're doing, normally you'll say, fine. I am fine. I am just fine. And also we have a wonderful method of just coping. We cope. We cope really well at face value. So on the phone, I'm coping. I'm absolutely fine. I'm coping. But if we actually get in front of you and actually start asking questions and start seeing the missed opportunities and start seeing how you're coping in your home and how things are in general, we can actually start to address those as well through different methods that we have. We have a huge plethora of resources that we can link you into, and we can also signpost to other organisations. We're certainly not a one-stop shop or a one-size-fits-all, but we can certainly be the link that can actually bridge the gap between where you are at the moment as an individual and certainly where you'd like to be, and we will certainly do what we can.
And I think social prescribing now is quite widely accepted nationally. Green social prescribing is a little bit different, but the Bristol and the BNSSG area is part of a national green social prescribing pilot. So it's one of 7 sites nationally that has a 2-year funding pot to trial green social prescribing. So hopefully
I think as well, to say, as someone who's working in organisations where people might get brought to us, there's definitely more work to be done and more work around supporting the organisations or the people like us who people are going to come to, because often we get some really challenging people coming in.
I was just about to ask, like, is there a plan? So I might get someone who's been referred through their GP, but I don't know what the process has been for them to be referred, and then they come to Friends of Grey Park, and we don't know anything about them, so we're not necessarily, we don't necessarily know how to kind of manage, or they might not even mention that they've come through a green social prescribing network. So I think there is, like you're saying, there is, in order to make sure that like the great work that's done in getting people to these projects doesn't kind of fall through, that the projects, there needs to be more work done with that kind of two-way communication, so that the projects are there and they are ready, they know who's coming to them and what they can do to support them, and they're ready, so that they can kind of catch them when they get there. and kind of hold on to them. And I just wondered if there was any, the question was, is there any plan to do that?
Well, certainly with the individuals that come through my social prescribing service, so with Community Connect, we are essentially, we're not a crisis service and we're not an emergency service. So the individuals that come through, we first of all need to identify that the service is suitable for them. So we would also identify that if there's any underlying root causes, then we actually would look to refer them to the appropriate service before we can actually support them through social isolation and loneliness and actually work with them on that basis. Nobody should be coming to a service outside of social prescribing or anyone that's referred to unless they are identified as being someone that will be able to engage and will actually benefit from that. However, we're very conscious that there are lots of referrals that come into various services where if they're identified as being social isolated and lonely, it's kind of almost a fast track, okay, that's the route they're going down, whereas actually looking at root causes and understanding, well actually, is there something else there? And I don't know if you've heard, but there's actually the setup in the area of the recovery navigators, which is actually going to be working alongside secondary mental health to actually work alongside the social prescribing service to identify if there are people who are being referred into the service that actually do need some additional help before the social prescribing element can kind of interact and engage. So I'd be really interested to hear more about how we can certainly talk afterwards and link you in with some of our services so that you can actually ask questions and actually be part of feeding back into the service itself, because it's really important that what we don't want to do is waste anybody's time, namely the patients, namely the customers, but also the people that could receive volunteers or actually be part of a bigger thing as far as kind of community development. So I'd like to talk afterwards, please. Brilliant.
Any other questions?
I'm just quite interested to know about how you evaluate and measure the contribution, because obviously it's funded. Are there good ways of being able to say what the outcomes are and what the benefits are, so that this is just going to become a growth, particularly that with social prescribing and that being piloted? It'd be great to think that that can become funded or incorporated. I know that you mentioned about policy and benefits, and I know that in Japan, that's government funded forest bathing. We know the evidence is there. They need to pick that up and fund as well. Yeah, so I'm just interested in that and how you actually measure the outcomes and how that might support growth in the future.
So the question was about evaluation and how do we report outcomes from these kind of projects, because we probably all know intuitively that they're really good, but in order to get longer term funding, funding bodies normally require some sort of evidence that this has worked before. Yeah, I mean, we think a lot about kind of evaluation, but it's not something I'm specifically involved in, and I don't know whether anything the three of you do you get asked for particular reporting requirements? Is there data that you have to feed back to funders?
Yeah, for sure. I mean, the local green prescribing grant that I got, and I think you guys got as well, there's this kind of before and after scenario, which is like, how do you're sort of asking people how they feel before they've started doing something, so, and then they continue to do that thing, and then they're asked at the end how they feel afterwards, and under a load of different sort of criteria, like mental health, well-being, connection with nature, connection with people, all of those sorts of things. And I suppose then there's a sort of more anecdotal, qualitative, that's more interesting actually from my perspective, but probably from a funder's perspective. It's like
They quite like numbers, don't they?
Like the numbers, yeah. But actually, you know, from a delivery point of view, in order to sort of, you know, see if what you're doing is having an impact because you're actually seeing it on the ground, it's much more interesting and useful to have those conversations informally. And, you know.
because I was just thinking that often the evaluation is quite clunky and difficult, being given to people maybe who haven't done it before, and again, the evaluation is often done to people, not with them. So I think there's something that we could really work on, and actually that's where people like us who've got creative skills could do more around actually doing really good evaluations that are around people's real experiences and are meaningful. But the way maybe the questions are asked at the moment, it could be more meaningful, I think.
Yeah,
for sure.
you sort of get in what
you get out what you put in, don't you? And
Yes.
if the wrong questions are asked, then you're only going to get something.
I think there's a balance between what I think, as far as quarterly reporting that we have to do, there's something called social return on investment, which is where everyone's really fixated on the figures. But then also there's something called emergent outcomes, which for a new project or something that's just getting off the ground where it's never been done before, so no one actually knows what's going to happen as a result of that. And I think we are very fixated on social return on investment figures because we are expected to essentially reflect something in a qualitative or a quantitative manner, whereas actually what we're actually trying to measure is the benefit to the community. And as such, what you actually are asking the question of, when we have benefited the community, then that's your outcome. We can demonstrate the fact that people are feeling better, and people can tell you that they're feeling better because you can ask them. But you don't want them to be giving you a score out of 10 or 7 or 8, because actually that only reflects on how they're feeling at that point, at that time. And it's just too much of a snapshot.
Yeah.
I want to point it, Johnny, but I also want to say it's back to what you were saying about you just know that it works. You just know. And actually, so to try and put that into facts and figures and things which meet funders' requirements, I always find so difficult.
I have a question with Steve for everybody, really, based on what you just said, Steve, because accepting that analysis of how somebody may have benefited can be a bit tick box and not really very qualitative, it's quantitative. But is there any research on basing analysis of impact on the individuals who go through green prescribing and go through the getting in touch with nature as experience rather than counting how it worked for them and for the institute. What about from the wider perspective of society?
I think that's a brilliant suggestion, in all honesty, because certainly from a lot of us as individuals, and if we've been on the receiving end of either commissioning or funding, a lot of it is about proving that we were worth the investment into, as far as actually we've invested in the community. And I think actually it should be that those questions are pushed out to the community as far as, rather than us trying to answer. I think it's a really valid point. I think it would actually
become so much better.
Absolutely, yeah, absolutely. I think, in all honesty, yeah, absolutely.
That's really interesting.
Absolutely.
That
I
is
think
a
it's a
brilliant
really good
question,
one.
and it's one of the that's such an important question when it comes to evaluation and the meaning of projects, that it's so much more than an individual's mood score out of 10. That actually because what we're talking about here, particularly with nature, is stuff that affects everybody and affects people at the community level, and I think that's often missed in evaluations. I think we've probably got time for one more question. Were you about to ask a question? Oh no, sorry. If there aren't any more questions, then no. Should we bring it to a close? So I'm looking at Beth and moving my head.
Can I just say something? This Sunday we've got a autumnal apple pressing community gathering over at the Italian Gardens, the little structure. There's a hexagonal planters and a watering system, so you can come and find out about that project. And we'll be pressing apples and doing other merry outdoors type things this Sunday 2 till 4:30. Please come along.
I'm going to lean forward now. We've got an event in Grove Park on Monday. I completely forget the time. I don't know whether 11 o'clock. Thanks, Natalie. For World Mental Health Day, which is just going to be, it's very low key. It's conversation and cake and maybe some activities which I'm yet to plan over the weekend. But yeah, so come along and have some conversations with some of the people who work in Grove Park Monday, 11 o'clock.
While we're throwing out. Let's just go on Wednesday from 10 o'clock till 3 p.m. At Rector's Way, Frostway Outdoors. There is a bird box making session, which is a connection with nature.
That sounds brilliant. I'd like to go to all of those things.
I feel as though I need to chuck
Yeah,
something
do
else
you-
in now. I was going to say I'm going to my nans. I mean, I don't know. But no, actually, on Monday between 1 and 9, there is an event at the Winter Gardens, which is about healthy workplaces, and the Community Connect team from the West area will be there from 1 till 5. So if you do want to meet any of the wellbeing workers and just have a chat about what we actually do and how we do promote green social prescribing, and also we like a challenge. Tell us if you're doing something that we can refer people to. So we like to keep our resources up to date, and Vicky, who manages our resource bank, is absolutely just like a whippet as far as grabbing stuff from people, as far as, oh, you're doing that, great, we'll get that on the list as well, we'll keep checking it's up to date. So do come along and have a chat.
Brilliant.
I think also on Wednesday, we're doing a walking group at 9:30, meeting at the police station.
So many things.
Takes you all over Somerset. There are 14 different people for free.
Oh my gosh, there's so much going on.
I love it.
That's amazing.
Great, there we are, brilliant.
I think most days of the week are covered.
Yeah.
Brilliant, thank you.
Thank
Well,
you.
please join me in thanking our brilliant panel. That was a fab talk and fab questions. So, I feel slightly ridiculous now, but I was coming up to tell you about the next events, but now I'm saying about so many. If you run quickly now, we're going to move to the sanctuary for our next talk, which is hearing from some brilliant students and course leaders about arts in hospitals, which we'd love you to join us for if you are free. And this evening in Grove Park, we're going global. There's going to be a brilliant event with food from Anna at Loves and an amazing film and lots of other great stuff that you can find out about in the programme. But please come to everything. It's all free and it's all brilliant. So thank you and thanks again.
Thank you.
Thank you.